According to a National Public Radio report this week, nearly a dozen states are considering tightening laws relating to vaccines. Joining me to offer her perspective on proposed legislation in Minnesota is Senator Chris Eaton. Welcome.
Thank you.
Before we get to what did pass the Senate, let's start with one of the bills that you introduced this session that would remove the conscientious objection from parents. Right now, they can conscientiously object to having their children vaccinated. It would remove that qualifier. Why is this important?
Well, I think, you talk about the herd immunity, the protection that everybody being immunized gives to people who have a suppressed immune system, who are getting treatment for cancer or have another, catastrophic disease that's messed with their immune system. And, babies under 6 months can't be immunized, and they're very vulnerable. And then a lot of people who are over 60 who either had the disease or were immunized when they were younger are probably not that protected anymore. So it puts a lot of the elderly at risk. So in the concerns for public health, that's my motivation for that. Also, I think the disease is much more dangerous than the vaccine. I would never say that there's no side effects to the vaccine, but I think it's been grossly overplayed. I don't think that any of the side effects are anywhere near the 1 in 1,000 kids with measles who get encephalitis, a form that you get with measles that's untreatable. You die. So we had over 100,000 kids in the world, basically, with measles die of measles last year. So it's not a minor disease. I know when I was a kid, we had measles parties, but that's because there wasn't an option.
I had chickenpox parties,
yep.
And now there's a chickenpox vaccine. But it's true to say that there are more people who are conscientiously objecting than there used to be, and that is the impetus for the need for this bill. Is that correct?
Right. There was a false report by a doctor who did a fake study that's been discredited, but it got a lot of play on the internet and social media, and a lot of people believe it. And also, when the ages that children get vaccinated are also the ages when a lot of problems show up. When you first notice somebody might have autism, when you first notice that somebody might not be developing like they should, or when a seizure disorder shows up, and all of that. So a lot of that coincidental things get attributed to the vaccines that probably had nothing to do with them.
Well, let's turn now to what did pass. There was an amendment that Senator Scott Jensen offered. This was also your bill, and it was successfully added to the Omnibus Health and Human Services bill that would create a grant program to address vaccine-preventable diseases. Is this a good, at least, first step?
It is. I think we need to do some education in the community, and I think we need to make it less scary. I mean, if we could even separate out, I've talked to Senator Dr. Jensen about separating out the different immunizations, instead of having the MMR, if we could just have the measles and not, mumps and rubella are not as common. And if we could just do a measles vaccine that it might be less threatening to some people, because that really is the more dangerous of the three. And so I think it's a good start. There is a companion in the House that I believe passed,
So potentially at least grant programs for the future. Senator Jensen is also a guest this week, and I asked him to speculate on why people's perceptions of vaccines have changed. He puts some blame on that medical establishment itself because of the steady stream of contradictory information about a number of things, cholesterol or eggs or any number of things. Do you agree that our medical institutions and professionals bear a little bit of the blame for the misinformation that's coming out?
I think it's a combination of things. It's also the sensationalizing of it by the press. When a study comes out and says you can drink wine and it'll keep you from having a heart attack or whatever, and then the next day, no, alcohol will actually hurt your health. I mean, those things are make for good headlines, And and studies, none of those have been backed up. They haven't done the double blind or any of the scientific repetition that you need to do to prove that that study was actually any validity. So so I think that's a big piece of it. So in a way, yes, he's correct. But I don't think it's the medical community that are coming out with these things. It's just those studies, they get published in the medical journals, and then the press picks up on them, and they put them out as fact. People don't understand the scientific process or the scientific method. That all these are is one study showed this. Nobody's repeated it yet. Nobody validated that study.
There's also a philosophical point that's been raised. The public radio report I mentioned in my introduction quoted an Oregon woman who's considering leaving the Democratic Party over this issue, though it's not necessarily a partisan issue. But she said, quote, "The Democratic view has always been about choice. My body, my choice. Choice in medical care for my child is no different." So what do you say to those who think that vaccinations are part of the pharmaceutical profit-making and an overreach by government?
Well, I certainly see their point. I believe that people should have a choice of what they do with their children, but there's also public health. If we had a Black Plague outbreak, we'd be locking people in their homes and not allowing them to leave. I mean, that's how public health works, is we protect the public from each other when those type of things happen. After talking to a lot of them, I'm a little less comfortable with forcing the immunizations than I initially was, but I still am concerned that a lot of the people have been so convinced of the danger of the immunizations beyond what is reasonable or scientific that they're putting their children at danger. My concern is the children. I never even occurred to me about the parents' right issue. I want children to not die from measles, and there's no reason for it. We have the vaccine. Before the vaccine, our cemeteries were full of children dying from these childhood diseases, and we haven't had that, and we don't need it now, but it's happening.
And the public memory of those things is past. It was generations before with polio and smallpox, and so our memory as a society has shortened. While I've got you here, I want to ask you one more question. You are on the conference committee to deal with opioid abuse and prevention. Can you give us a brief update as to how that's going?
Well, it's not moving as quickly as I'd like. We've done a lot of testifying or taking testimony. To start out with, both bills were so different. The only thing in common was they both raised $20 million and they both had an advisory council. But everything else was different, how the money was raised, who was on the council, and so on. And the Senate bill has a sunset that the House bill doesn't. So those are all points of contention right now, and I would say that most of it will be pretty easy to overcome. Probably the struggle is going to be around the sunset, but I still see a path for agreement, and I'm still hopeful.
Less than 2 weeks to go, and you're still hopeful.
I am.
Senator Chris Eaton, thank you so much.
You're welcome.